Welcome to our channel, Systems. In this video, we're exploring the essential topic of wounds, their types and treatments. Whether it's a minor cut or a more serious injury, understanding how to properly care for wounds is crucial for effective healing. We'll discuss different types of wounds, from abrasions and lacerations to punctures and burns, and provide insights into the best treatment methods for each. Join us to learn about wound care techniques, prevention tips, and the latest advancements in medical treatments. Don't forget to like, subscribe, and hit the notification bell for more informative content.
Written by Dr. Pimple Popper, a renowned dermatologist known for her expertise in skin care and wound management. A wound is any kind of injury that breaks the skin or other body tissues. This can occur due to various reasons such as accidents, surgical procedures, or even certain medical conditions. It can be as simple as a small cut, which might happen while chopping vegetables, or as serious as a deep burn from a fire or hot liquid. Wounds are a common part of life, and most of us will experience them at some point. From childhood scrapes to adult injuries, they are almost inevitable. Wounds can be painful, itchy, and unsightly. They can cause discomfort and sometimes even lead to more serious health issues if not treated properly. They can also become infected if not cared for properly. Infections can lead to complications, making the healing process longer and more difficult. Understanding the different types of wounds and how to treat them is essential for everyone. This knowledge can help you respond quickly and effectively when an injury occurs. This knowledge can help you stay safe and healthy. Proper wound care can prevent infections and promote faster healing, ensuring that you can return to your daily activities without prolonged discomfort. In the following sections, we'll delve into the world of wounds, exploring their types, treatments, and how you can promote healing while preventing infection. We'll cover everything from minor cuts and scrapes to more serious injuries that require professional medical attention. Whether it's a minor scrape or a more serious injury, knowing how to care for a wound is a valuable life skill. This knowledge can make a significant difference in your overall health and well-being. Open wounds are injuries that involve a break in the skin, exposing the underlying tissues. These wounds are often visible and can bleed, depending on their severity. Open wounds require prompt attention to prevent infection and promote healing. There are several types of open wounds, each with its own characteristics and potential complications. Understanding these differences is crucial for proper wound management. In the next few sections, we'll explore some common types of open wounds, including abrasions, lacerations, and punctures. We'll discuss their causes, symptoms, and how to differentiate them. Unlike open wounds, closed wounds occur beneath the skin's surface, leaving the outer layer intact. These wounds are often caused by blunt force trauma, such as a punch or a fall. While they may not be immediately visible, closed wounds can be just as serious as open wounds. One of the most common types of closed wounds is a contusion, also known as a bruise. Contusions occur when blood vessels under the skin are damaged, causing blood to leak into the surrounding tissues. It's important to remember that even though closed wounds don't break the skin, they still require attention. Monitoring for signs of infection and seeking medical advice if necessary is crucial for proper healing. An abrasion, commonly known as a graze or a scrape, is a superficial wound that affects the top layer of skin. These wounds are often caused by friction, such as rubbing against a rough surface or a fall on pavement. Abrasions typically appear as red, raw areas with minor bleeding. They can be painful due to the exposure of nerve endings in the damaged skin. While abrasions are usually minor injuries, they still require proper care to prevent infection. Cleaning the wound thoroughly with soap and water and applying an antibiotic ointment can help promote healing and reduce the risk of complications. Lacerations, tears in the skin. Lacerations are deeper wounds that involve a cut or tear in the skin. They can be caused by sharp objects such as knives or broken glass, or by blunt force trauma that splits the skin. Lacerations can vary in depth and severity, from minor cuts that only require a bandage to deep wounds that may need stitches or even surgery. Bleeding is common with lacerations, and controlling it is the first priority. Applying direct pressure to the wound with a clean cloth can help stop the bleeding. Depending on the severity, medical attention may be necessary for proper wound closure and to minimize scarring. Punctures, deep and dangerous. Puncture wounds are a serious type of injury that can have significant consequences if not treated properly. Puncture wounds are caused by sharp, pointed objects that penetrate the skin and underlying tissues. These objects can vary widely in nature and can include everyday items as well as more dangerous implements. These objects can be anything from nails and splinters to knives and bullets. Each type of puncture wound presents its own unique challenges and risks. Punctures often appear small on the surface, but they can be quite deep and carry a high risk of infection. The depth of the wound is not always immediately apparent, making it crucial to assess the injury thoroughly. This is because bacteria and other contaminants can be pushed deep into the wound, creating an ideal environment for infection to thrive. Infections can lead to serious complications, including abscesses and systemic infections. It's crucial to seek medical attention for any puncture wound, regardless of its size. Even seemingly minor punctures can become problematic if not properly treated. A tetanus shot may be necessary, especially if the object that caused the wound was dirty or rusty. Antibiotics are often prescribed to prevent infection and ensure the wound heals properly. Deep puncture wounds may require surgery to clean out the wound and promote healing. Surgical intervention helps to remove any foreign material and reduce the risk of infection, ensuring a better recovery process. The importance of timely wound care. Prompt and proper wound care is essential for preventing infection, promoting healing, and minimizing scarring. Ignoring a wound or treating it improperly can lead to complications, such as infection, delayed healing, and even tetanus. The first step in wound care is to control any bleeding. Once the bleeding is under control, the wound should be cleaned thoroughly with soap and water to remove any dirt, debris, or bacteria. After cleaning, a sterile dressing should be applied to protect the wound from further contamination and absorb any drainage. The dressing should be changed regularly, and the wound should be monitored for signs of infection. First Aid 101: Caring for Wounds. Knowing basic first aid for wounds can be invaluable in an emergency situation. Whether it's a minor cut or a more serious injury, taking prompt action can help minimize damage and promote healing. For minor wounds, such as abrasions and small cuts, the first step is to clean the wound thoroughly with soap and water. Once clean, apply an antibiotic ointment and cover the wound with a sterile bandage. For deeper wounds or wounds that are bleeding heavily, apply direct pressure to the wound with a clean cloth to control the bleeding. Elevate the injured area if possible. Once the bleeding is controlled, seek medical attention immediately. Professional wound management. For more serious wounds or wounds that show signs of infection, it's essential to seek professional medical attention. Healthcare providers have the expertise and resources to properly clean, close, and dress wounds, minimizing the risk of complications. Wound management may involve a variety of techniques depending on the type and severity of the wound. For deep cuts or lacerations, stitches or staples may be necessary to close the wound and promote healing. In some cases, surgery may be required to clean out the wound, remove damaged tissue, or repair underlying structures. Wound care specialists can also provide guidance on dressings, medications, and other therapies to optimize healing and prevent infection. Preventing infection, your body's best defense. Preventing infection is crucial for proper wound healing. When a wound becomes infected, it can delay healing, increase pain and scarring, and even lead to serious complications. One of the most effective ways to prevent infection is to keep the wound clean and covered. Wash your hands thoroughly with soap and water before and after touching the wound. Avoid touching the wound unnecessarily. If the dressing gets wet or dirty, change it promptly. Be on the lookout for signs of infection, such as redness, swelling, warmth, pus, or a foul odor. Promoting healing, giving your body a helping hand. While your body has an amazing ability to heal itself, it sometimes needs a little extra support to do so efficiently. There are several proactive steps you can take to support the healing process and minimize scarring. Eating a healthy diet rich in protein, vitamins, and minerals provides your body with the essential building blocks it needs to repair damaged tissues. Incorporate a variety of colorful fruits and vegetables, lean proteins, and whole grains into your meals. Staying hydrated is also essential, as water plays a vital role in cell regeneration and overall bodily functions. Aim to drink at least 8 glasses of water a day, and more if you are active or recovering from an injury. Getting enough rest is crucial because it gives your body the energy it needs to focus on healing. Aim for 7 to 9 hours of sleep each night to allow your body to repair and rejuvenate. Avoid smoking, as it can interfere with blood flow and delay healing. Smoking reduces the amount of oxygen that reaches your tissues, which is essential for the healing process. If you have any underlying medical conditions, such as diabetes, it's important to follow your doctor's advice for managing them to promote optimal wound healing. Proper management of these conditions can significantly impact your body's ability to heal. Regular checkups and consultations with your healthcare provider can help you stay on track and address any issues that may arise during the healing process. By taking these steps, you can give your body the best chance to heal effectively and efficiently.